morning, afternoon, or evening, where in the world you are. So welcome to the Gender and Digital Health webinar series that is a platform to foster new partnerships and co-create knowledge on the gender dimensions of digital technologies for health. We have a focus on translation of evidence to policy and practice-based learning in low and middle-income countries. The webinar series is organized by a consortium between the United Nations University, the International Institute for Global Health, the University of Cape Town, and BBC Media Action. So this is the third series of the webinar, and the theme of the webinar today is the technology use in response to gender-based violence. So shortly we will show the agenda and the panelists. So we will have some introductions of 10 minutes, the introduction to the topic, and then we will have presentations of 10 minutes with the 5 distinguished speakers. So we will have Jun Shu and Lynn Monrawi presenting from Twitter, presenting the gender and digital health on Twitter. And our third panelist is Zinnya Del Villar, from DataPop Alliance, reporting and registering domestic violence against women in Latin America. Our fourth panelist is Lisa Vetten, from the University of Johannesburg, presenting on reporting on technology use in response to gender-based violence in South Africa. And we have Megan O'Donnell from the Center for Global Development, presenting on the global evidence on gender-based violence. And we will have some 5 to 10 minutes of discussion with the discussant, Shubhalakshmi Nandi from the Bill and Melinda Gates Foundation in India. And the discussant will do a summary and some remarks about the presentations, and we'll ask some questions to the presenters. And then finally, we will have a discussion of Q&A of about 20 to 30 minutes. So please introduce yourselves in the discussion forum and share any comments that you can have there. We can also share some resources and some links. And if you have any questions for the panelists, please use the Q&A at the bottom of your Zoom screen. Okay, so maybe to introduce the topic, let's start with some definitions that will distinguish between the gender-based violence and violence against women. So we will hear about 2 different concepts during this presentation. So according to the UN, gender-based violence refers to harmful acts directed at an individual or a group of individuals based on their gender. It is rooted in gender inequality and the abuse of power and harmful norms. Violence against women is more specific against women, and many times it's linked to children, violence against women and children, or against women and girls. So violence against women is any act of gender-based violence that results in or is likely to result in physical, sexual, or mental harm or suffering to women, including threats of such acts, coercion, or arbitrary deprivation of liberty, whether occurring in public or in private life. And in terms of the estimates, the global estimates of violence against women, or the gender-based violence, a very recent report that was launched by WHO just reveals some very alarming numbers that were not different from the last report that was launched in 2013. So this report is based on data from 161 countries, and this data is household survey data, that has questions about the lifetime prevalence that has to do with whether women women who are in a partnership, or who have ever been in a partnership, have been subject to physical and or sexual violence from a current or a former husband or male intimate partner. And 26%, that is about 1 in 4, respond that they have been subject to this violence. When you look at the prevalence in the past 12 months, the figures are also very alarming. So we can, if we consider girls 15 years and older women, 10% have been subject to physical and whole sexual intimate partner violence. So these estimates are compiled from surveys from 2000 to 2018. So we don't have very accurate, reliable estimates for the last year and for this year, but we know with the COVID pandemic, these numbers would likely went up. And that's all the different data sources that indicators have been telling us. So one of our presenters, Zynnia, is going to tell us about ways of measuring violence against women in Latin America and the challenges of the different data sources.
In introducing this, Claudia and I also just wanted to sort of take this broader context where we know that there's a high burden there's a high prevalence of violence against women, and we wanted to sort of conceptualize how technology has been used in response to different violence against women initiatives. There's not a lot of literature on this, not a lot of literature that is on the intersection of technology use and services for violence against women. However, COVID-19 pandemic has really accelerated this. So there is a review that was recently published that focuses on the sort of pre-COVID window, and it gives a nice snapshot and a nice overview of some of the different applications. And these are noted here on the slide, and you can see by the figure on the right that there's a distribution of about 5 different main categories through which apps have been developed. And so I should just mention from 2018, from 2010 to 2018, 171 different applications were identified across these 5 major categories. And you can see from the depiction on the right, about 47% of these relate to emergency applications. And just to give a kind of a sense of that, emergency applications are those which whose primary function is to offer immediate help to victims. There are other applications, including supporting applications, which aim to mitigate the social, physiological, or physical repercussions for survivors. There are reporting apps, which are really self-explanatory, but they enable users to report incidents of violence. There are avoidance apps, which help us to avoid at-risk situations. And then there are education apps, which again is quite self-explanatory, but collectively you can see the varied ways in which technology in the context of applications has been used in this area. Our panelists are going to go through a variety of sort of new innovations in this space, and I hope this very much will sort of paint a broader picture as to how technology use can be used more broadly to address this very important area. And so with that, we're going to turn to our first 2 speakers from Twitter. So may I please introduce June, who's the head of public policy in the greater, could you go to the next slide, Claudia, for me? Who's the head of public policy for Greater China for Twitter. In this role, June leads Twitter's public policy agenda with government agencies, elected officials, not-for-profit organizations in the region. She also oversees Twitter's philanthropic initiatives for the region. And prior to her current role with Twitter, she was a government and public affairs consultant for companies operating throughout China. June's going to be joined by her colleague Lynn, who's a dual qualified Thai and American lawyer and public policy professional with over 10 years of experience in law and policy. She's the head of public policy and philanthropy for the Southeast Asia at Twitter Asia Pacific, and currently based in Singapore. So they're going to do a dual act and really tell us more about sort of innovations on the Twitter platform around this space. And so without further ado, we're very excited to have them here. I turn it over to you, June, and to Lynn. Next slide.
Sorry, I think you need to share now, June.
Lynn,
okay.
That would be Lynn who would be sharing.
Okay, sorry.
Thank you so much, Amnesty, for the introduction, and also for your earlier slide talking about the intersection between technology and violence against women. We are here also to learn from all the panelists as well as from the audience. So good morning, good afternoon, good evening to everyone that just tuned in. Thank you to UNDP for the opportunity for us to discuss this very important topic as well. Next, Lynn. Great, yeah. I think we can go straight to the third slide. We just introduced ourselves as well. And before we dive right into gender-based violence, I do think it's important for us to zoom out a little bit to talk about Twitter and our general COVID-19 response strategy. Obviously, Twitter needs no introduction. We do have a few key characteristics that differentiate us from our our peer companies, and which help inform our COVID-19 response strategy. Twitter is what's happening. It's real-time, public, conversational, and it's truly a conversational platform with very diverse discussion going on, which is why Twitter's mission is to serve the public conversation. What that means is to give everyone the power to create and share ideas, informations instantly, real time, without barriers. So I do honestly think that Twitter is a very mission-driven company. Next slide, please. And next, I want to introduce the team that Lynn and myself are working on, the public policy team. We are one of the most mission-driven teams within Twitter, globally diverse, and each of us cover a market. Basically, we are the way to think about us is we're the corporate ambassadors representing Twitter in front of governments, nonprofits, international organizations, academics, and other external stakeholders. For the purpose of this discussion, I want to highlight our third piece of work, Twitter for Good, which is basically our corporate philanthropy. There are 5 areas that we are most focused on, and that includes free expression, internet safety, and today, very relevant, is equality. We work very closely with organizations on women empowerment issues. I want to give a shout out to the UN agencies globally and regionally. We do work very closely with all of you, worked both in globally as well as in APAC, including with the UNDP, UN Women, the UNICEF and UNESCO, etc. Next, please. So Twitter's goal as it pertains to COVID-19 response is we want to leverage our policy, products, partnerships, and philanthropy during this critical time to do 3 things. One is to reduce the spread of harmful information. Second is to elevate, amplify credible information. And then the third piece is to support the needs of our customers and communities. Next, please. And when it comes to policy, the first thing that we want to do is we want to make sure that our Twitter rules are evolving at the same time while real life is happening, to recognize the unique challenges of COVID. I want to give a shout out to a very recent policy related to COVID-19 vaccine misinformation. We are applying labels to tweets that may contain misleading information about COVID vaccine, which is not very GBV related, but I do want to give a shout out. Next slide, please. So here's just a quick snapshot of the progress of July 2020. So far, we've suspended 2,400 accounts for violating our guidelines. We moved close to 8,500 tweets. And we've also challenged at least 11.5 million accounts that were targeting discussions about COVID-19. And next, please. As mentioned, our goal is to serve as credible information. So I want to highlight that Twitter is the first tech company, the first, that roll out a notification service to refer people to find credible information about COVID. I remember that it was July 24th, which was Lunar New Year Eve, just when COVID hit Wuhan really, really hard, and everywhere else, people weren't paying as much attention. Since then, that was the day 1 that we deployed this Know the Facts prompt. Since then, by now, we've have this expanded to over 80 markets in 29 languages. Our partners include national public health authorities, as well as international organizations such as the World Health Organization. Next, please. And in addition to that, we have been working in close partnerships with governments, experts, academic experts, NGOs around the world that are responding to COVID-19 with a goal to elevate credible information these are just some examples of what we've done. One thing that we didn't highlight in this slide is that we also earlier on had, say, for example, an emoji campaign with UNICEF based in Bangkok and the WHO for a global campaign to encourage people to wash their hands and stay at home or for mental health concern. So for our philanthropic mission, so far we provide advertising credits and over $1 million and works with over 100 government and international organizations. And without next, I think that's without further ado, I want to introduce Lynn, and I want to give her a shout out because she is the champion behind the global expansion of a prompt about gender-based violence. Thank you, Lynn. Yours.
Thanks, June, and hello, guys. As June has shared with you regarding our proactive work around COVID-19, Twitter has been working with NGOs, local government, together with UN agency as part of our philanthropic mission through our Twitter for Good work. We look at some data and more research in terms of how can we understand the issues around COVID-19, and we should be able to assess the need of the there is help notification from or service where it is needed the most to extend our work around COVID-19. And one of the outstanding areas that we have seen is around gender-based violence during the lockdown. For example, please allow me to share with you the UN Secretary General Antonio Guterres has repeatedly called out recently the global lockdown announced during the COVID-19 pandemic and have resulted in a horrifying surge in gender-based violence, and which further deepen existing gender inequalities given the burden of caring of other vulnerability individuals at home, especially for young children or sick or elderly family members. And you can see on the right hand here, our colleagues from UN Women also provide quote and the need of how is it important to keep the service available. And we look at other data in terms of more importantly, our NGO partners, government agency partner that we partner with around the world. I just give you some specific example here in countries in APAC. We have this statistic with us. For example, in Australia, a Women's Safety New South Wales survey revealed that 40% of frontline workers have reported increased requests for help by survivor, and 70% have reported that the case received have increased in the level of complexity during the COVID-19 outbreak. Or in Indonesia, an NGO, Jakarta Legal Aid Foundation, or we call LBH APIK, provides support to women survivors of violence, record a tripling of reported case of violence against women. India is nonetheless also domestic violence has increased more than twofold in 4 states in the north since the beginning of the pandemic, and the increase has doubled, from 116 to 275 cases within a short period of time. In Malaysia, that you can see here, hotlines for women and children in Malaysia have reported a 57 increase in calls, while other aims at controlling movement are in effect. The Women's Aid WAO in Malaysia has also recorded 44% increase in reported case of domestic violence from February to March. We also see the numbers in South Korea, also in Singapore, where the increase 33% in call receiving from in February comparing to the same month in 2019. So these are the sorts that we see, and once we realize, we think that there is a dire need of attention here due to the surge of gender-based violence during the lockdown. Twitter would like to be a force as a part of to combat gender-based violence, and we want to take the lead by building on our existing There Is Help notification service that we have previously launched, such as on mental health issues or vaccination, or the prompt that June did explain before around COVID-19. As a result, we decided to launch this dedicated gender-based violence search prompt for hotlines and support in local languages. We work in close partnership with UN Asia and Pacific, who play our advisory role, as well as leading NGOs and government agencies that provide critical emergency care, support, and counseling. These are like take a long time because for us, we have to go and research who would be a good partner, who would be able to provide a hotline, and who would be able to accept the calls, because it's a real public and private partnership when we look at the context of each country in response to a surge in gender-based violence. And as our colleague here mentioned, that there's a difference between gender-based violence, sexual violence, domestic violence. We want to make sure the keyword that we're using should cover all of this due to on our prompt. And we are very proud to be the first company that launched this service. And in June, we are the first time that we are launching this prompt and made available in multiple locations in multiple languages, because we really believe that this partnership will be able to contribute to the effort of local organization. They are the one that actually doing all the hard work, and how can they ensure people can access and receive support when they need it the most. Now, in total, from March 2020 last year until now, over a period of year, we deployed to 27 countries in 30 languages. In a short period of time. And we are committed to expand these services in the near future to other countries in the region or across the globe in the coming weeks and months. My last slide here, I want to share with you some specific example of case studies. Apart from this is the third party that are very happy and support in terms of the partnership. Let's have a specific example in Thailand. Since we launched, one of the NGO partner called Hack Project that based in Thailand have received about over 100 of call and messages in their inbox on DM on Twitter asking for help. They have successfully referred cases to law enforcement, which led to successful arrest and related government agency to provide assistance to the victims with social welfare services. They also help report some of the account or shutdown on Twitter, together with the challenges that they are not able to help alone. So they refer the case to other NGOs that they are working on this topic. And most of the case, sometimes they want to talk about and share about what they are going through. Even though the NGO might not be able to help them, they also try to talk and empower them. And I want to end it here that like our online world is a reflection of the offline world, and it reflects the best and the worst in us. So what we really want to highlight in this is like the partnership between private and public partnership, and also with the NGO, like civil society and UN agency has proven to become like successful case. So I will end my presentation here. Thank you.
Thank you so much, June and Lynn. That's just a fascinating sort of overview of the There Is Help notification service. I think this is probably one of the sort of the largest examples we have to date of such a service on a social media platform, which aims to kind of harness the potential of AI technology to improve identification and access to services for violence against women. We really sort of commend you on this, and the fact that you've sort of launched in nearly 30 countries in over 30 languages is pretty impressive. So thank you for that fascinating overview. So Claudia, can I hand it over to you to introduce Zynnia, please?
Yes, please. Thank you, Amnesty. The next panelist is Zinnya Del Villar. She's the research director in data science at DataPop Alliance in Mexico. She's a data scientist, a statistics professor, and biostatistician researcher with extensive experience on health economic, finance, and political data analysis in Mexico, the US, and France. And Zynnya is also promoter of STEM women and gender equality. She's going to tell us about a study that DataPop Alliance carry with the GIZ, and the title of her presentation is Reporting and Registering Domestic Violence Against Women and Girls in Latin America, in 3 countries in Latin America. So Zinnia, the floor is yours. Please say next, and I will go to the next slide.
Yes, thank you, Claudia. So I will present in these minutes the principal insights and results of the project elaborated by DataPop Alliance in collaboration with GIZ Data Lab and GIZ Network Unidas. In this project, Claudia was advisor too in the part of gender. Next one, please. This project is an analytical model to measure domestic violence during the COVID situation. And the key message of my presentation are the need of public policies on data sharing in disasters and under or emergency, for example, COVID epidemic. In the topic of violence, we don't have data quality due to the homogenization of the definition of violence, as well as the different types of data depending on the temporal and spatial granularity of each database. With this project, this is an example that shows the roadmap to follow where innovation tools can help to measure in real time violence against women. Next one, please. The problem. Before the pandemic, 35% of women have been physical or sexually abused by their partners. This is during the in Latin America, only 12% of these women report violence against women. During the pandemic and during assume in the 3 countries where is the scope of work, for example, Twitter registered 431% in reports of partner violence with sign of domestic violence in Brazil. In Colombia, the helpline 123 increased 54% in call related to intimate partner violence. And in Mexico, 4 months after the start of quarantine, reports on violence against women and their children increased in 81% in comparison to the same period in 2019. So our objective of this project is how we can take advantage of the existing data to better understand domestic violence and generate public policies that can help fight this issue in different contexts. Next one, please. Our project consists on 2 stages: centralize the data of violence, registers and report crimes, and analyze the factors that impact the registering and reporting of violence against women and girls in the domestic setting. For what? To produce insights for decision makers to contribute to the literature about factors that affect violence against women, and to generate results that contribute to filling in the information and data gaps in Latin America. Next one, please. Our definition of violence against women in the domestic setting is an intersection between intimate partner violence, between violence against women and girls, and between domestic or family violence. That is our definition of violence against women in the domestic setting, and we have 4 types of violence: physical, sexual, economic, and psychological. Next one, please. Our work, is important to notice that the capabilities that we talk about are the capabilities defined by Amartya Sen that makes reference to the opportunities the state offers, which facilitate or hinder the possibility of reporting, registering, and or looking for help if a woman suffers violence. So when we talk about capabilities, we are talking about this type of capabilities. Next one, please. This project, I show you in this slide the methodology that is an iterative and mixed methods. include quantitative data, qualitative data, and literature review. Inside quantitative data, we have administrative databases of the 3 cities, official statistics, and mobility reports of Google and Facebook. Qualitative data, we did 12 semi-structured interviews in 3 sectors: academia, public sectors, and CSOs. And we did a literature review about 147 articles in principal focus in Latin America in 3 languages: Spanish, English, and Portuguese. At each stage of the project, we had the advice of the Council of Development Guidance and Ethics Code, composed by more or less foreign experts by city, country for 3 sectors: CSOs, academia, and government. And then they advise us in the ethical principle of research and the ethical principles in data management. Next one, please. The stage of the statistical model are described in this slide. In the stage 1, we measure the number of cases reported with the administrative databases. The stage 2, we measure the impact of the risk factors, this impact as a conditional probability that a woman reports given her context. And we map the registering capabilities and reporting according to the granularity chosen in each city. Only in the case of Mexico, we extrapolate the model outside Mexico City to all the country. Next one, please. I will show our results first stage, and I scope only the results of Mexico. Well, because we have a lot of results of each one of the countries, so I will show you only from Mexico. And the first stage is the analysis of the reported prevalence in Mexico. Next one, please. Okay. To understand what we are talking about, the data used in this project is the little circle that is the registers shared with those. The second circle is the reported violence, all registered administrative and civil society. We had the estimated violence, that is the survey of in NSOs and National Medical Institutes. And we have this dark figure that is the violence through the time. So we have a focus only in the little circle. Next one, please. The data that we have from Mexico, we have data for helplines, Línea Mujeres, investigation folders, and helpline 911. The access to each database depends of the modalities differs and waiting times of each database. So for Línea Mujeres and investigation folder, we have open data, so we have access immediately. For helpline 911, we ask through the transparency law and receive it 2 months later. And unfortunately, for the National Shelter Network Registry, we request we request directly, but due to the limited capacity, they cannot share their data with us. Next one, please. This is the principle. For example, the calls is the red line. The investigation folders is the yellow line. So we can see that the gray period is the lockdown strict periods in Mexico City. So we can see that the yellow line and the number of investigation folders that show that decrease during the lockdown. The red line is the helpline Línea Mujeres that shows an increase before the lockdown period. Why before the lockdown period? One hypothesis is that from February, news from feminist sites, in particular that one of a girl whose mother asked for help, the authorities for help, spark a feminist movement that dominate the media and culminate in the largest feminist march manifestation in March, the International Day of the Woman. So this is one hypothesis why this call center increased before the lockdown. Next one, please. This is only a part of statistical, how we create we add all these registers, and from these registers, we subtract the percentage of double entries. And then for the head mount, we create, we calculate the corresponding quantities. Next one, please. This is an example of the week 13 on 2020. The dark blue is the smallest number of the reports, and the opposite is the larger number of reports from each city according to the granularity chosen. Next one, please. For an example of analysis of risk factors, next one, we focus only in these factors. Well, you can read it quickly. And for example, for each factor, next one, please, we have age. We focus in age, for example. So we have the probability, the conditional probability that a woman that suffered violence, if she has between 30 and 49 years, is highest than if than a girl of between 0 and 14 years in Mexico. So this is only the focus in age. Next one, please. The conclusion and recommendation about data is grouping in divided into 4 groups: access to data, coverage and data disaggregation, quality of data, and data governance. Access to data, increase the access to make the process efficient in access requests. Coverage and data disaggregation, increase the spatial and granularity and time granularity, and include more sociodemographic indicators in each database. Quality of data, improve the conceptualization of different types of gender violence, and add identifiers to measure the incidence of victims that use more than one service in order to avoid duplicity. Data governance, improve the articulation and interoperability of data between public institutions, adopt ethical and data privacy guidelines, and promote a culture of evidence use to inform public policies for violence against women. Thank you.
Thank you very much, Zynnia. It's such a fascinating study, and I think from this study there's 2 or 3 very important messages. And first, I think this study is very innovative in the way that use data, as it combined different data sets that we know that each of one is imperfect on its own, but using this algorithm and using data science is possible to calculate, to estimate the violence against women that will be comparable across these 3 countries. So I think that is very innovative. And I think it's also very interesting the fact that the channels for reporting or the mechanisms to reporting violence against women, like courts and hotlines, they are not working. We know that they don't work in a situation of lockdowns during the pandemic. So it was very interesting to look at your graph and see that in the first weeks after the lockdowns, there was a trend in terms of the number of calls to the hotlines that then the trend went downward. So yeah, so I think that's also very, very strong evidence for some hints or guesses that we may have about violence against women. And finally, I think your study just stresses the importance to have quality and open access data in a way that it protect protect the woman. Of course, that these data that we had access, maybe didn't have enough time to explain, but this data from the city of Mexico, it was the hotlines. This data was made available for the public at the level of granularity that wouldn't allow to identify the woman who called to the hotline. So it's possible, when you think about this type of very sensitive data, it's possible to make transformations of data and aggregations in a way that we protect the identity of the people. So I think that these are all very important points, and I hope that they will be picked up in the discussion. So thank you for your contribution, Zynnia.
So Claudia, I'm very excited. Our next presentation goes perfectly in alignment with this, I think. So we've just done this great deep dive into Mexico. And if you're just joining us, I should mention that we started today's session with a wonderful presentation from our colleagues, June and Lynn from Twitter. And they gave an overview of some of the innovations related to the Twitter platform's hashtag campaign for gender-based violence, which has been implemented in nearly 30 countries nationally. Claudia just gave a nice overview of Zinnia's presentation. And this brings us to our second country deep dive, which is going to be on South Africa. And so I'm thrilled that Lisa Vetten is here. And for those of you that don't know Lisa, she holds two institutional affiliations, so she wears multiple hats. The first is one in the Faculty of Humanities at the University of Johannesburg. The other is at the Southern Center for Inequality Studies at the University of Witwatersrand. Her current research project focuses on the experience of domestic violence shelter workers and their residents during lockdown. And the second is a comparative study which utilizes predominantly ethnographic methods to trace gendered violence and urban transformations in Gurgaon in India. So Shubhalakshmi and our colleagues from India, look out. And as well here in South Africa and Johannesburg. And the latter is a collaboration between a multitude of organizations. So before Lisa kicks off, so just a sort of a word of view for those of us that are here in South Africa, just in terms of a broader context, I think it's important to sort of bear in mind that many of you will be aware that South Africa has had the highest burden in the region here in Sub-Saharan Africa for COVID cases. For those of you that were able to attend our last session on COVID and gender, you will have seen our colleague Andrew Boole from here in South Africa present trends across the country, but specifically here in the Western Cape, which suggest that women were the early sources of the spread of COVID here. And that's predominantly because they're essential workers. So the greatest incidence has been with women, but the impact in terms of adverse outcomes has been disproportionate towards men. And in that sort of context of a high disease burden related to this epidemic in the region, you also have very high mobile phone penetration and mobile phone use. So in contrast to countries like India, where many of our colleagues are from, where women only have about half the population of women have access to a phone, here in South Africa, there's gender parity in access to phones. So access to phones is nearly universal across the entire population. So it's a very different sort of digital environment. And I think it's worth bearing that in mind as Lisa presents. So without further ado, Lisa, can you come in and help me out here? What I wonder if we do, Claudia, if we just move on to our next speaker and circle back to Lisa at the very end. Can I suggest we do that?
Yes, of course. So yeah, let me introduce our next speaker, Megan O'Donnell. She's the Assistant Director of the Gender Program at the Center for Global Development. She's a Senior Policy Analyst working on issues related to women's economic empowerment and financial inclusion, gender data and measurement, and development effectiveness. And she's going to present on the global evidence on gender-based violence in past crises and COVID. The floor is yours, Megan.
Hi, thanks so much, Claudia and Amnesty. To give you a quick overview of the areas I'll be touching on before diving in. First, I'm going to present, as you can see in these first two questions, pre-COVID data and evidence. So as the pandemic was first spreading, I, with a number of co-authors, realized that we wouldn't have data specific to the COVID context for some time. But in order to inform evidence-based policy responses, wanted to look backwards to historical crises like Ebola, Zika, H1N1, to get a sense for the risk pathways through which violence against women and also children may increase, and some of what the evidence tells us about promising policy and programmatic responses. In a second piece of this presentation, we'll then turn to the COVID context, do a bit of an overview of how national governments are responding in seeking to prevent violence, but also help survivors. And then finally, we'll review work that I've done with Amber Peterman, now reviewing over 100 papers that are specific to violence against women and children in the COVID context, and I'll map out some trends, takeaways, and also what we're seeing as sort of persistent gaps in the data and evidence. So next slide, please. This graphic, I won't go into detail on, but I will drop the link to our working paper in the chat for those of you who may be interested in diving in. What it basically does is maps those pathways that I mentioned from historical crises that allowed us to predict within the COVID context how violence against women and children would be anticipated to increase. So many of these, as hopefully you can see okay, relate to violence within the household, intimate partner violence, and other forms of domestic violence. Because when we think about the added stress that comes from financial insecurity due to lost employment and income, when we think about the increased time that potential perpetrators spend with victims, and also the constraints or the barriers to victims exiting the household, relying on social support networks or other support services, a lot of that is sort of a recipe for disaster within the household. But I'll also note that the pathways included non-domestic violence forms as well, such as the exacerbated risk of violence against frontline health workers. Next slide, please. And then here is a breakdown, again, based on that historical evidence of what has worked in past contexts and other crises, what we anticipate policymakers should prioritize as they are seeking to respond to the shadow pandemic of gender-based violence within the COVID crisis. I'll go into these over the course of the presentation in a bit more detail, but just for now, want to note that a lot of these relate to addressing those risk factors around financial insecurity and the tensions within households that can be exacerbated because of it. So for example, providing cash transfers or in-kind food transfers to households to ease that burden. And then a lot of it also relates to support services for survivors. So for example, sort of consistent with what June and Lynn presented earlier, harnessing these virtual or digital channels to provide support to survivors in a socially distanced world. Next slide, please. So now turning to COVID and what national governments have done within the crisis as they've acknowledged the need to address this shadow pandemic. We rely really heavily on what you can see here is a response tracker that's been compiled by UNDP with the support of UN Women. I'll note that it's just been updated earlier this week. So now what was about 2,500 policy response measures now reflects over 3,000. Unfortunately, very few of these are gender sensitive, but I'll get into that in a second. Next slide, please. So the tracker includes a focus on policy response measures related to violence against women and girls, but it also looks at things like economic and fiscal policy, labor market, and social protection measures. And I'll note there that of those measures, less than 20%, unfortunately, are gender sensitive. The tracker takes at face value that anything related to violence against women and girls is gender sensitive. That's now about 800 of the 3,000 measures that are documented in the tracker. And I'll get into those in the next slide. So here you can see that the vast majority of actions being taken, being announced by national governments as it relates to violence against women fall within high and upper middle income countries. So we're still seeing relatively little coming out of lower income settings, in spite of the fact that we anticipate and our review shows that this is a global problem, right? That doesn't stop within certain geographic borders. And so we would hope to see sort of rising attention and policy response in those lower income country settings as well going forward. Next slide, please. In line with the focus of this webinar, we did a deeper dive both into the platforms that are harnessing different forms of technology that the tracker reflects or demonstrates. As you can see here, the vast majority, when they're talking about technology, are still reliant on using phones. But then there's still also a decent amount reliant on social media. As sort of a fun fact, we looked into Twitter that is explicitly referenced within the policy response efforts of Albania, of Cote d'Ivoire, of India, and several other countries. And then other forms of technology like a reliance on websites, SMS and WhatsApp messaging, TV announcements, emails, radio, and using other apps. I think important to note here is not only the benefits that technology can have in this socially distanced context of reaching vulnerable populations in need of support, but also important to keep in mind the risk of excluding those and of exacerbating issues sort of predating COVID around the gender digital divide. So when we note that 200 million fewer women than men worldwide do have access to, for example, a mobile phone, it is at sort of risk for excluding those populations as we harness these platforms. Next slide, please. So in addition to the platforms that the tracker reflects, we also took a look at the purposes for which these platforms are being harnessed. And you can see that at the top there, a lot of this is aimed at raising awareness, both around the risk of increased gender-based violence, but also campaigns that seek to provide information around support services, as June and Lynn presented earlier. Then the rest of these measures really relate to continuing, or in some case expanding or increasing, the support services available to survivors. So these are things like hotlines, shelters, psychosocial support, and also access to police and judicial response, court systems. Next slide. I will note as one additional sort of absent piece of that last slide that we're not seeing a lot yet in terms of how technology can be harnessed for prevention within the COVID context, even though there is a bit of evidence to suggest that in some cases, outside of crisis at least, things like SMS platforms can be influential in shifting social norms. So that is, I think, an outstanding research question, and more interrogation there is needed. This final piece is what I mentioned earlier, the review that we've sort of had rolling on an ongoing basis as more and more evidence has come out about whether violence against women and children is increasing during COVID. Our last published review was out in December as part of the 16 days of activism. And at that point, we had 44 studies that showed on the whole that at least one measure of violence was increasing. So 45%, as you can see here, of the papers we reviewed, all of which had to sort of pass muster from a rigor standpoint, have clear indicators, clear methodologies, clear samples. 45% of those papers just showed increases across the board, whether in IPV, domestic violence, violence against children, et cetera. An additional 25% of those papers showed mixed findings with at least one measure of violence increasing. So you see that then 70% of these papers as of December showed, in fact, and sort of confirmed the original intuition, all of our fears that violence has in fact increased during COVID. Next slide, please. So the takeaways sum up in part what I've just said. I think the only caveats to note are, one, even where violence in some of these studies is reflected to decrease, we should continue to take that sort of finding with a grain of salt. A lot of evidence suggests that that may in fact be due to underreporting because of those constraints on victims to be seeking help services and therefore have sort of their incidents of violence reflected in official data. This is especially a risk around younger populations, children, in light of school closures. The other things to note is that more and more papers are proliferating around risk factors, noting things like mental health, substance abuse, and as I mentioned earlier, financial and economic insecurity as really the drivers of exacerbated violence. While too few studies still, just 5 out of the now 100 we've reviewed, examine or interrogate the impact of evaluations, or I'm sorry, of policies and interventions aimed at preventing violence or supporting survivors. And then the final slide. Now this is sort of a sneak preview for you all because we'll have this latest 4th research update out in the coming weeks. But to preview it, we do a deeper dive into studies now coming out of low and middle income country contexts. And we see that that figure of 70% of papers documenting increases in violence has now increased that much more so. Our latest round of papers, nearly all of them are documenting increases. Unfortunately, just one of the papers, sort of a consistent trend across our 4 research roundups, evaluates an intervention aimed at preventing violence, a really great study out of Bolivia on a youth empowerment program that shows effects of decreasing violence against adolescent girls. But beyond that, our call to action sort of across the board has been that more research attention is now needed on evaluating those policies and interventions aimed at either preventing violence or supporting survivors. So I'll end there. Back over to you, Amnesty and Claudia.
Thank you very much, Megan, for this excellent presentation. I think there are so much content here that we would like maybe to continue. And I think maybe the 3 main takeaways from your presentation first is the fact that only 5 studies had some measures related to the effectiveness. So from these 3,000 policies that are in the UNDP and UN Women gender tracker, it's, you know, like the percentage is really, really small. So it means that we need more evidence, we need more studies, more research on policy effectiveness. And there's also one very important point that you said that was related with the digital gender gap. So when we look at the policies that use technology to respond to violence against women, and we saw that the 2 main channels of communication are digital channels. There was internet and mobile phones. So I think besides the question of access, there's also the question of use. So we know that in situations of violence, women and girls, they may have their devices barred in terms of not being able to use, or maybe the use is monitored by their partners. So it raises the same question that are these policies, are these channels the most adequate in a situation of violence, particularly in a pandemic where women and lockdowns where women cannot leave the house and they need to live and sometimes share the devices with the perpetrators of violence. And my last point is related to this amazing work that I think UNDP and UN Women is doing to create this global data set that can be used by policymakers and by researchers. So I just want to stress that this is an open access resource, and we have the link in the presentation that anyone can access for doing analyses, and also for example, for low and middle income countries or other countries to be inspired to what has been done globally, even if you don't have the effectiveness of these policies. So thank you very much. And I think now I'm going to hand over to Amnesty to see if
let's try, Claudia. Let's I know Lisa's had some network issues, but let's try, and if you could just take us back slide-wise there. We'll go take 2 on South Africa. Lisa, if you can unmute yourself, and can you give us a shot? Can you hear us?
Yes, can you hear me?
Perfect, great. So Lisa, we've going to try and just definitely keep this to 10 minutes because we want some time for our discussant to come in at the end, and then there have, of course, been different questions. So again, just for those of you that have just joined us or come in late, Lisa's going to talk to us about GBV and digital tools here in South Africa. Over to you, Lisa.
Thank you. So my presentation, I think, starts to look at some of these questions about policy and what is the connection between digital tools and help. So it focuses very much on the kinds of ICTs that are connecting women to help, but I will be focusing on one that doesn't necessarily do that. And it's quite interesting to look at how women are using that. So I think one of the comments to make in relation to South Africa is that there was quite a number of digital innovations being used across sectors before the lockdown, and that there were also a range of different kinds of partnerships between government and the private sector, so Vodacom and MTN, the two cellular phone service providers. Plus, you've also had partnerships between or they've developed between the NGO sector and the private sector. And one can certainly see somewhat of an acceleration. I think things were already in the pipeline, but the lockdown certainly drove or accelerated the speed at which new digital innovations were introduced. Secondly, I think it's incredibly difficult to understand increases in GBV during COVID lockdown. Short of a prevalence survey, our available data, which I'm going to go through for you, does not paint a very clear picture at all. In fact, paints a very challenging picture. And the third point being that there are real limitations in relying on call center and police records to measure GBV trends. And then lastly, we shouldn't forget that technology is a tool. It doesn't work, then the technology is in some ways redundant. So just as a quick overview as to what was in place in South Africa and what developed during the lockdown, is we have one chatbot, Rainbow, which works on AI and also is available via Facebook Messenger. We had two telephonic hotlines, one run by the government, which is the Gender-Based Violence Command Center, and the second by an NGO called Lifeline. And as a consequence of the lockdown, a third helpline opened specifically dealing with shelters. Then we also saw the emergence of partnerships between e-hailing systems to facilitate shelter access. That also started in the lockdown as a direct response to difficulties. Then there have also been two apps. One was launched in November of 2020. One is at the RCT stage. I'll talk a little bit to those a bit later. And then GovChat, which just opened, was launched this month. And then I think throughout the lockdown, one saw sorted uses of WhatsApp, Facebook, and Twitter, kind of along the lines what was being mentioned in Asia. So people trying to use what exists to reach out and get help. Next slide. So in terms of trying to understand, in the absence of being able to do a prevalence survey during a lockdown, around whether or not there were increases in GBV during the lockdown, the main point is we should really not take records at face value. So this is from a study we have in progress that's looking at the experience of shelters, and in particular the impact of government policy and responses in the way they, in some cases, undermine the work of shelters during the lockdown. So our three primary sources of data, the first was the call center. So this is managed by the Department of Social Development. It was established in 2014, and it runs in close partnership with Vodacom, a private service provider who provide the technological end. So those systems are very sophisticated in terms of being able to geolocate people, link them up to emergency services and the like. The second helpline, and I haven't used their data for that reason, although it was established in 1999, has very limited funding and data elements. So much of their data collection is manual. It relies on the counselor to record afterwards. Sometimes all you can get from that system is just the count of the number of calls. So you can't distinguish between what are unique callers, repeat callers, and the content of calls. So that helpline I haven't really looked at. Next, please. Next slide. The second source of information are police records on domestic violence, and you will see, I think, some of the limitations of those when I have a look at them. And the third, it was shelter records of admissions. I haven't presented those because that analysis is still in progress, but they point to a very interesting and complex and mixed picture. Finally, we have not looked at court data because that's really a measure of access to justice. So we didn't really look at that. We looked really at what were questions of possible prevalence or what was happening, and what did that perhaps tell us about access to services. Next slide, please. Okay, so the main source of information that people relied on in order to get some sense of what was happening during the lockdown was the Department of Social Development's Gender-Based Violence Command Center. And this did seem to indicate there had been a very significant increase. So if you look at the roughly 3 months prior to the lockdown, on average, the command center was receiving 151 calls per day. But during the lockdown period, it was receiving 500 increase. But this is the point about looking very carefully at what are calls about. So this data comes directly from Vodacom and is based on the way they categorize.
So Lisa, we've lost you again. So I think with this slide again, you know, what we're seeing here on the page is the calls, use of USSD, daily SMSs, and then the total column, which sums, you know, the 3 prior, that looks at daily utilization of the call center during lockdown and prior to lockdown. And what I think Lisa is going to point to is about a 3 times increase in the number of daily calls, 100% increase in the daily USSD, and a 4-fold increase in SMSs. And I think overall what it showed was a spike in the utilization of call centers. But if you put that in the context of GBV related cases, you don't see much of a change. It's about just a 1% difference pre and post. So I think her point, I don't know if you could hear us, Lisa.
I can hear you. My signal's back
again.
Great. Can you hear me?
Okay, great.
Yeah,
so Lisa, I've just taken them through this table, and I was just making the point for you that basically you see this high utilization of call center data, but actually when you look at GBV, it's not happening proportionally for GBV. Really, that's only increasing from pre-lockdown numbers by about 1%.
That is correct. So that is correct. So just looking at the total number of calls to a call center is a very poor indication of the content of those calls, who is a repeat caller, who is hanging up, who is not actually making a connection. So it's not the best place to look. And if we can go to the next slide, please, and you'll see why when I start to look at some of the next slide here. So I think not only did people not look at the granular detail of how the command center was being used, the problem there was even worse compounded by the misinterpretation of command center data. And here, you know, within the first week of the lockdown, the Minister of Police made a very disturbing statement, which was that 87,000 GBV calls had been made to the GBV call center during the first week of lockdown alone, which caused enormous alarm and has been amplified numerous times across the internet. If you search South Africa, that's what you will find, is those 87,000 calls. And because of inaccuracies, his subsequent correction that 87,000, that number of 87,000 actually referred to the total number of calls made for the whole of 2019 got lost. So most people are left with this impression of this dramatic increase. He modified it subsequently to 2,300 being reported in that first week. But again, one must take into account my point about the fact that there was clearly a great deal of distress and concern happening in South Africa, but people were not necessarily using the Gender-Based Violence Command Center in order to make calls dealing with GBV. I think one of the consequences that had is that the command center became the center of attention because of the numbers. And one saw the private sector, for example, leaping in to bring PPE to the command center due to all this concern around how overburdened they were. Important, but again, if you are wanting to make a GBV intervention, the command center was not the place to be making it. And here I want to just spell out some of the consequences of that, is that the vast majority of shelters dealing with domestic violence in South Africa are run by NGOs. They're dependent on government subsidies and they're dependent on fundraising. With the lockdown, their ability to raise funds through events, was severely curtailed. Many companies who used to be able to give them money said, we can't anymore, we don't have the money. And in some provinces, one in particular, subsidies were paid 3 months late. So shelters had no money at all for 3 months. At a time when they also had to pay unanticipated costs, including transport for staff to get to shelters, accommodation for staff because of concerns of potentially exposing their staff to infection on taxis. They were paying for private accommodation. They were also having to pay an increase, obviously, in food. So they got hit at a time when they didn't have the money and couldn't raise the money with a massive number of unanticipated costs without seeing the resources going to them, but instead seeing them diverted into one particular service that attracted a great deal of attention. And frankly, if it was a government service, should have been supported by government. Next slide.
So Lisa, we've got to wrap you in 3 minutes just to give you a sense.
Okay, so I think just as a lot, I'll take a look at the police data. So I think here we can see that the police data is not helpful either. So if you look at the column on the right, you will see 21,000 domestic violence cases reported in more or less the same period on the right, on the left-hand side, which looks at the same period during the lockdown. And you can see that the number of reports reduced by a third. That was not because, as our minister liked to suggest, they'd made alcohol very difficult to obtain, and so nobody was drinking, and so everybody was behaving nicely at home, but rather the restrictions on being able to get to shelters, and that the restrictions on movement meant that women had to rely on the police to take them to shelters, but the police were not available, and you can see why. They were, during that same time period when they had the 6,651 domestic violence cases reported, they dealt with 230,000 people charged with contravening the lockdown. So you can see that that's where policing attention shifted. And that was one consequence why in about July, the national shelter movement turned to Uber to start transporting victims to shelters. Uber is only available in 4 provinces, however, but it did help. And it is a free service that's being provided by Uber. And then as a consequence of some of the difficulties with the helpline, the National Shelter Movement opened its own call center in December of 2020. So I think, should we skip the next slide then?
Yeah, I think let's maybe just take us through. I mean, just your last slide there just is talking about these 2 apps. And I think it's important to, again, just reflect on the diversity. You've got an app here and a chat bot. They're using artificial intelligence. You know, there are some concerns about this. I think the most important salient one here, and it's picked up by from some of our other panelists, is really that, you know, these apps and the technology is great, but often they make assumptions about existing services and health systems, you know, being in place and able to handle the demand, which perhaps isn't true. So again, underscores and brings us to your last slide. Claudia, next slide. Really just on these closing reflections. Over to you, Lisa.
Yeah, so firstly, I think the first point is that trends in data can be a very incomplete way of storytelling. Our goal is not to count how many women are being hit and hurt. Our goal is to understand what is the connection between that being hit and hurt and their ability to access a service. So I think when we focus only on the numbers, we lose that. So the focus is South Africa as an example, those high numbers forgot to look at the other part of the story, which was, were women getting to services? I've also given the example of how imperfect data can end up skewing attention and resources away from essential services to those who should have services. And the last point is that ICT is really just one tool of a much larger arsenal, that there must be continued emphasis on the scaffolding that supports health systems and services to women. Thank you.
Lisa, what a wonderful, wonderful presentation. Thank you so much. I'm not going to summarize it because you've just done it beautifully for me there, and we're short on time. So I'd now just like to turn us to our discussant. We're so privileged to have Shubhalakshmi Nandi from the Gates Foundation. She's responsible for the foundation's Greater Equality portfolio in India. She's a senior program officer there, and prior to that, she was director of policy at ICRW. She's also worked as a policy specialist at UN Women, among a multitude of other roles, and of course is extremely passionate about linking grassroots feminist voices with policy. So Shubhalakshmi, over to you. Thank you so much.
No, thanks so much for having me. And I think it's been such a fascinating set of presentations. I know we are running out of time, but I'll just focus on what I picked up as some critical themes that I thought I heard the speakers talk about. I think one, of course, right at the beginning, we heard about the value of digital platforms in messaging, right? In reaching out, in making sure that, there is a recognition of the fact that gender-based violence might be increasing and that, we're listening. And I think the Twitter example very clearly showed some of that. We've heard that anecdotally from our work in India as well, right? That just use of the networks to reach out to women using the digital has been such a critical thing through the COVID period. We heard a lot about reporting on violence and the measurement of violence. I think that is a theme I'd like for us to think a little bit about, because I know Lisa says we should not take the data at face value. In Zinnia's case, we saw how the actual cases in court and reporting actually went down during the lockdown. But anecdotally, we also know that where there were in-person, somewhat social safety sort of nets, groups, women's collectives, we found that women have found support. So I think we should think a little bit about this question of reporting, this question of data, this whole, Megan clearly said that studies are showing at least one measure of violence is increasing. And I think we should think a little bit seriously about looking at not just the sources of data and where we're gathering this data, but discrepancies sometimes in defining gender-based violence. And I know you started the conversation today by talking about GBV and violence against women, but I don't think many of our countries have those kinds of mature data sets, data systems. Administrative data is not really giving us that kind of rich granular information that both Zinnia and Megan were talking about. So I think it's very important to think about reporting and measurement in that light. And of course, the question of data governance, is there interoperability? Is there the ability to share and exchange learnings from the different sources that we have? Very, very critical issues. I also think that we spoke not very much, and maybe I'd like the speakers to respond a little bit to this point, about what was driving either the use of those digital tools or the reporting of violence. We heard a little bit from Zinnia and Megan about age, marital status, education, economic insecurities, etc., being drivers of the pathways to violence based on pre-COVID research as well as post-COVID analysis. I'd like for us to think a little bit more about unpacking what those factors and those drivers might be. And I think we must also definitely look at some of the promising practices, as Megan was saying. But again, I think we have to keep our eyes open for things like, let's just take the example of the cash transfers that Megan talks about, the link with increased violence in cash transfer programs if the social norms are not addressed, if we're putting cash in the hands of women. So I think depending on context, we need to look at whether there's unintended consequences. And so coming to, therefore, a few of the questions that I'd like to open up to the panel and have them sort of reflect on is this whole question of measurement and reporting. What are your reflections on the underlying structural drivers and pathways? What are some of your reflections? What is the solution really to making sure that we bridge the digital divide that many of you addressed, right? You spoke about, I mean, that's at the basic level of access, even if we don't talk about use. So these are a few thoughts. And just to say that I think maybe we also need to think a little bit more about the offline social networks and processes that mediate women's ability to access, control, and use digital assets. So with this, I'd just like to open it up for the panelists' reactions and thoughts.
Great. Thank you so much for those sort of really insightful comments. We need another hour to just dive into some of the issues you've raised. I just wonder if I'll just start, one of the most important questions you raised was around what's driving the use of the tools. So just wonder if any of our panelists want to take that on. or if you have any other things you want to respond to in any of the plethora of comments that Shubhalakshmi has kindly sort of raised. Megan, could we start with you, perhaps? And just to note, I noticed you put a ton of resources up, so thank you. Megan has just given everybody a download of part of her brain in terms of some of the sources. So thank you, Megan. Over to you.
Absolutely. And we'll have, as I mentioned, the last one up in the coming week. So that'll be the full 100 papers that I referenced during the presentation. You know, you may have seen me sort of going like this in response, because I think Shubhalakshmi highlights an area where we still have persistent questions rather than clear answers. And I think we've been frustrated, right? And the call to action that I ended with is reflective of the fact that I think far too much research has sort of gotten hung up on, is violence increasing or isn't it? Rather than moving to what Shubhalakshmi mentions, which is what's driving it. And as Lisa also really emphasized, how are support services being accessed and benefiting women and girls? So I think as a community of researchers, policymakers, practitioners, donors, we can sort of agree to now switch gears, say, yes, in fact, this was a problem that pre-COVID was a huge human rights development issue that never got the attention it deserved. And now, regardless of whether it's increased 10% or 20% or 50%, how are we going to prevent and support survivors when it does occur?
Thanks, Megan. That's important. We just had one question for you from our group, which is, why do you think so few policy measures have been evaluated?
I think it's all happening to us in real time. So I am hugely sympathetic and empathetic, right, towards researchers who are now struggling in this virtual world to gather data, right? And we know the limits of mobile phone and internet surveys in terms of reaching the most vulnerable populations who don't have access to those platforms. I think in the interim, where we've needed to get a bit creative and hopefully can continue to take this approach, is to harness that historical data, right? We don't have to reinvent the wheel. DFID, now FCDO, for years has run this What Works initiative that tells us the evidence-based policy interventions like cash transfers that can have real sort of catalytic effects in mitigating the risk of violence in the first instance. So I think while we're waiting sort of for the data to catch up to the reality we're all experiencing, looking backwards is sort of the best we can do at this moment.
Yeah, so I think Lisa's going to hop in here with a response. Lisa, do you want to hop in?
Yes, and I think it's very important that we look at country contexts. I mean, if you look at what has happened to South Africa's economy, for example, it has been really quite damaged. The impact on unemployment has been significant, especially in relation to women's unemployment. So it raises real questions around what is going to be possible in such a resource-constrained environment, and what is it that women could potentially lose, given the way that all departments have been told to cut their budgets in order to accommodate these harsh new economic realities. So I think it also means policy making, depending on where you are in the world, will have to end up being looking very difficult and very different.
Great. I'm so sorry that, you know, we just don't have, we had hoped for this sort of 30 minutes for discussion, but we've, you know, always run out of time a bit. I just note a couple of sort of burning questions have come in the chat. So I'm going to, you know, kind of go through them a little bit quickly, and then Colin will come in and close us out. And we can always sort of follow up by email, et cetera, for questions. So there's been a note to you, Lisa, from Simone, which is to thank you for your talk, and, you know, to sort of suggest that you disseminate the information, perhaps in the Daily Maverick or a similar such sort of newspaper type of source. So we encourage you to do that. There are a couple comments to our colleagues at Twitter. So the first question, a little bit challenging. You guys almost got off the hook as we ended, but I'm gonna bring you back, which is a question around mobile phone access and the gender gap. So we have a colleague from India that has said about 14% of Twitter users in India are women. So I just wonder if you can comment on, you know, sort of the gender gap in access to your platform and more broadly mobile phones, and what you think that means for a campaign like this and who potentially you're omitting. Over to you, June or Lynn.
Sure, I can start, and then if Lynn has something to add, she can do. So first of all, Lynn and I, myself, we are not market experts in India. Definitely, this is an area that we can look into, and if we can provide you more information about India's specific context and our user profile, or how we are addressing the problem, happy to have a follow-up conversation. I do want to mention that part of the Twitter for Good commitment is about gender equality. And I know my colleagues in India have conducted several campaigns addressing this gender gap. So that's the, for example, hashtag position of strength. That's a quick answer to what we are doing in India. Obviously, again, to echo the panelists here saying, every country is different, that we have to look into the specific context. And I do want to highlight here, because everyone here basically is a researcher, that one of the key things that we believe Twitter as a tech company that can contribute is Twitter API and our Data for Good program. So we started this Twitter API program in 2006. Basically, we make the Twitter API, the data available for researchers to conduct research for whatever topic you want, as diverse as the conversation that's taking place on Twitter. To Megan's point about the lack of data and the lack of evidence-based research, we welcome everyone here if you want to use Twitter, and let me ping the link to where to apply. That information from day one, the first tweet, could be available free of charge for academic researchers. And again, we are not subject matter experts on gender-based violence. What we can do as a platform that has the information, the data, the conversation is that we make this data available to enable the researchers to conduct the research to better have evidence-based, to inform better policy making. So I hope that would be helpful. And let me ping the link real quick. Lynn, do you want to add anything?
Thanks, June. I think June added all most of the relevant information, and just want to share some of the work that our colleagues in India has been doing in terms of not just only on this, but for example, the campaign that they have been working on, whether position of strength or the work that they have been doing. So gender equality is something that Twitter, as a company and our work has been really focusing on how can we promote gender equality. When you talk about in terms of the mobile access, we are promoting access to the internet, and also we support NGOs and support Keep It On campaign. And because our service is based on the internet, but if you ask apart from that, we will not be able to respond to you in terms of the offline. And this is the area that NGOs that are working on the ground, that are working on the offline time, they are the one that is the best suited to answer the question. Thank you.
Thanks, Lynn. So we just had one comment for you guys in the chat from Tracy McKee. Sorry for butchering the name. If you could just answer that for me. And then there's one final question from Prabhan Chandra, and then Claudia is going to come in and just close us out. That question is, what is the evidence on policies provided to shelters on COVID infection control? This is for South Africa. What do we know about how shelters are managed distancing and handling fears of infection? Because many women did not go to the one-stop shelters because of that fear. So Lisa, I don't know if you have a response to that.
Yes, there are a range of responses I can make. And this research study should become available in the next 2 months, where we've set out what was the policy response and how was it structured across South Africa. So I think one saw something very uneven. Some provinces were given guidance by the Provincial Department of Social Development. They were given protocols on how to screen, how to sanitize, how to put in place quarantine units. And they also set up a system of a first stop shelter where you could go for 2 weeks. And then if it seemed as if a quarantine shelter, if all was okay, you would then move on to a longer term shelter. That was probably the best example. Then you got to provinces where shelters were given no guidelines. They ended up making sanitizer based on recipes that they found on the internet. They were making their own masks. They had no idea what to do. And some actually closed for the first 2-3 weeks because they really just didn't know what to do and there was so much fear. Which also, I think, led to certain challenges and difficulties in shelters, and that sometimes women themselves were fearful of new women coming in. So there were some very complex difficulties that needed to be managed as well around stigma and fear. And part of our project asked shelter workers, we asked them to engage in a photo voice project to take photographs of what the lockdown was like. And the way they have captured that immense fear is really quite striking. I think a picture really says so much more than the words could have. But that seems to have governed shelter responses. Things are now much better. They have now received funding from the Solidarity Fund so that they can get PPE on a regular basis, so that where there have been infections, they are able to deep clean. There have unfortunately been the death of one resident and one shelter mother, a house mother, but there have also been infections. Fortunately, nobody else has died. But people, I think, are now at the stage where they understand what they need to do. They're getting the resources from the Solidarity Fund. They've gotten guidelines. They're sharing their lessons with each other, and things are better. But their funding remains very uncertain, especially because we're going into a new financial year and have been told to expect very significant budget cuts.
Thank you, Lisa, very much. So I know we're about 7 minutes over, so let me just hand over to Colm. Can you hop in here, Colm, please?
I can indeed. Thank you, Amnesty. Can you hear me okay?
Yeah, go ahead, please.
Fantastic. Just as a quick wrap up, thank you everyone for joining us. Particularly thank you to our panelists. I'm not sure if we got a following slide from this, but in terms of next steps, we'll be looking at circulating the presentations via email shortly. We'll also pick up any questions that weren't answered today, but I think we've covered all of them. Please do follow us on social media, and not just Twitter, but other channels as well. And we'll be announcing and promoting the next in the series of talks shortly. So just to reaffirm, as we mentioned at the start, this is a series of 12 talks over the next year or so. So very much looking forward to you all joining us later in the series. And thank you again for all of your patience with some of the kind of technical issues we've had today. It's been very much appreciated. Thanks, Amnesty.
Thanks, Colm. Claudia, do you want to just say any fleeting thoughts and close us out?
Yes, thank you very much. So I just want to thank you all for attending this webinar, and stay with us for the next webinar in April. And for any other events related to gender and health, please visit our Gender and Health Hub. And we have the Twitter, LinkedIn, and we have now a webpage as well. Thank you very much.
Thanks you very much to all of our panelists. We're so grateful, and of course our discussant. We hope you have a wonderful rest of the week, and we look forward to seeing you next month. Thank you very much, everybody.